In 1861, a Frenchman named Prof Meniere described this disease correctly. Previously, people who had sudden attacks of dizziness were thought to be suffering from a kind of brain disturbance. Meniere's work showed that these dizzy spells were linked with the inner ear.
Well, Meniere's disease is a disease of the inner ear. So the ear has three parts. It has the ear canal, where the sound goes down towards your eardrum. Then it has the middle ear, which has some little bones that sends the transmissions across to the inner ear. And then the inner ear is full of fluid, and in this fluid there's little nerve endings. And when the sound comes down and vibrates the fluid in the inner ear, it sends the vibrations to the nerve endings, which then transmit to the ear with the percept of hearing. Meniere's disease is a problem because of an overaccumulation of fluid in the inner part of the ear. So the ear, to begin with, quite suddenly fills up with fluid, and when this ear begins to drain, the person has an attack of dizziness because the inner ear contains both the hearing and the balance mechanism. Many people start just with a ringing noise in their ear. They may notice some fluctuation of the hearing, especially in the lower pitches. Some people notice a fullness. It's as if there's cotton wool in the ear, or they've been up a hillside and the ears feel slightly blocked. But of course many people don't reach the diagnosis of Meniere's until they have the actual attack of vertigo, and with the dizziness and with these other symptoms as well. Usually we can make the diagnosis quite easily. Well, when somebody has the very first attack of Meniere's disease, they're terrified. They think they've had a stroke or something dreadful's happened. And I think under those circumstances that person does want to go to hospital so that they can be diagnosed properly. But when somebody already knows the diagnosis and knows that they've got Meniere's, then they're not really wanting to have a trip to hospital because that often aggravates the symptoms. They just want to find somewhere nice, quiet and peaceful where they can lie down till the attack subsides. And I'm sure they would like their relatives notified so that they can get some help. And now, of course, they're going to need some help to get home. When somebody has Meniere's disease, often they have many attacks, so they may be very aware of what's happening to them. So the first thing probably is to ask them what's happening, and you'll know straight away that they're not drunk or inebriated, but they're suffering from a problem with their balance, and they'll tell you, I have Meniere's disease, I'm having an attack. For such a person, what they want to do is to lie still. They don't want to be moved sharply because any sharp movements cause dizziness. If they've had attacks in the past, then they may well have some medication with them, and this can be a great benefit. Sometimes tablets are not so helpful because if they swallow the tablet, they may vomit it immediately. So they might like to go somewhere private where they can either have an injection or even a suppository which will stop the attack. Meniere's disease goes through three natural stages. The first stage is when the attacks of dizziness are the predominant feature, and the hearing can go right back to normal between attacks. Then after a period of time, this may progress in about 50% of people to the second stage, when the hearing unfortunately is affected all the time. The attacks of vertigo still persist, but are probably not quite so severe. Then finally, this can go to the end stage, or stage 3, the burnt-out stage of Meniere's, where the attacks of vertigo cease, but the patient may feel a little wobbly. The hearing, unfortunately, is quite poor, although it can still be helped by a hearing aid. In the third stage of Meniere's disease, the balance becomes quite poor, but in some people they can suffer what we call drop attacks or Tumarkin attacks. And these occur without warning when the person may suddenly fall, losing strength in the arms and legs. Fortunately, these usually only go on for 1 or 2 years, but they can be quite a concern, especially in elderly people. It's very common in the blue-eyed, fair-skinned races. It's common in Europeans. It's common in Japan. It's less common in Asian people. And it's rarely found in people of black races, such as African races or the Australian Aboriginal.